Making Babies in Your 40s, Episode 2. So how best do you choose the right fertility specialist? Fertility specialists either work for an IVF clinic or they have their own practice. You don't want to be an extreme outlier at any clinic. Ideally, you want to be part of a subset of older patients. Obviously, that depends on how many clinics are in your area and whether you have a lot of small clinics or just one or two massive ones. The more densely populated your area, the more clinics you have, the more likely you will have access to a clinic that treats the harder cases, the 40-year-olds who on average have much lower success rates. If you have access to just the one clinic, which predominantly sees women in their 30s and the occasional 40-year-old, then you want the specialist who treats the 40-year-olds in that clinic. A good specialist is really one with good clinical experience treating older patients. A clinic that treats solely younger patients may not be attuned to your needs. Remember that often specialists get busy and leave the nurses to relay results, so it's helpful if they see 40-year-old patients too. Otherwise, they are more likely to respond to questions you have as if they were dealing with a younger patient. This first step, choosing a specialist who treats people like you, is really important. I'll give you an example. I had 3 good embryos from an IVF cycle. Usually there's this mad attrition with IVF, which is cruel. And the usual protocol is to implant just one embryo to avoid the risk of multiples. But for 40-year-olds, the option is sometimes given to implant more than one embryo because about a third of your embryos on average are chromosomally deficient. Of course, you have to weigh that up against the risk of multiples, but the point is the risk of having multiples in your 40s is much, much lower, and a 40-year-old's embryos don't freeze and thaw as well. That's a conversation you need to have with your doctor. It's complicated. There's a lot of factors to weigh up. But I found myself having the conversation with a nurse. She was only familiar with the usual protocol, which is to implant one embryo. She didn't have experience with older patients. My fertility specialist had previously said he'd be okay with implanting 2. So it was really stressful not to have that expertise available when I needed it most, between retrieval and implantation. Often it will make no difference, but in your 40s you have a lot riding on each cycle because it could literally be your last chance of having a baby. That is why it is so important to have a clinic that treats patients in their 40s. It goes without saying that older patients pull a clinic's success rates down because they're more likely to have failed cycles. So you can't go on statistics alone. The more older patients a clinic sees, the worse their statistics. So it's important to know both a clinic's statistics and the proportion of older patients they see. If a clinic is known for treating the hard cases, the patients who have come from other clinics and failed, then their statistics will be lower. Clinical experience is very important in IVF. Don't just go for the clinic with the best odds of success. Take age into account and find the clinic that understands aging ovaries best. Ask your specialist how many 40-year-old patients they've treated and how IVF differs for a 40-year-old. I can tell you in this podcast how I think IVF differs for a 40-year-old based on my experience. I also interview fertility specialists who will tell us how they think it differs. With that information, you should be able to work out whether your clinic will just treat you the same as the majority of its younger patients or treat you as a 40-year-old. You want your IVF cycle to be tailored to your 40-year-old predicament. No clinic will know in advance how your particular body will respond to IVF treatment, but they should know how the majority of poor responders due to age or other factors fare on different protocols at their clinic and in the research. It's a tricky business making a 40-year-old pregnant, so your specialist needs to be at the forefront of the technology, reading the latest research. If they have more patients in that age group, then they'll have more invested clinically in keeping up to date. The practice at clinics varies considerably in terms of the hand-holding you get through the cycle. I know this because I cycled at more than one clinic. What I mean is it can range from intense mothering, so you come to the clinic and the nurse helps you with your injections if you are squeamish and gives you a cup of tea, to really hands-off, just giving you a set of instructions and leaving you to it. So you may need to enlist your partner or someone else if you don't like giving yourself injections. Once and only once, I enlisted my husband in helping me with an injection. I can't remember what drug I was using, but I was given needles and the preparation was complicated in that the drug had to be extracted from a vial using one needle, a big one, and dispensed into another vial with powder, mixed, and then the needle had to be swapped for a much smaller needle because that was the needle to be inserted into me. My husband managed the preparatory steps fine, but started coming towards me with the horse-sized needle at speed. He'd forgotten to swap it out. And he thought I was just squeamish about needles, so he tried to quickly insert this scary-looking needle despite my protests. I don't know how, but I jumped across the full width of the bed, which nearly sent the needle flying, which would have been a disaster because we didn't have a spare injection kit. I was more than happy to DIY after that, every single time. It's also not just a matter of throwing everything at the problem indiscriminately and doing every add-on treatment available. I often see on forums, in interviews and in books, women who tried everything bar the kitchen sink. Intralipid infusions, endoscratch, embryo glue, assisted hatching, all of these strange sounding things. Sometimes you can be tempted to do that because you're in a panic. Every add-on I just mentioned has no good research backing it to show the treatment improves success rates. Women are desperate. Making babies in your 40s feels like a panic. So this episode is to help women who feel in a state of panic to make good decisions. It's not easy to think things through or research properly because you feel you don't have the time to investigate or research. You want to be doing all the extras to feel like you're getting ahead, bettering your odds, but oftentimes you may be worsening your odds. You need a good specialist to tell you about the utility of these add-on treatments, the risks, and whether there is research backing them. The people who I suspect who do all manner of weird and wacky add-on treatments are the ones most likely failing cycles, 40-year-olds. If anyone needs a leg up on the IVF ladder, it's a 40-year-old, so you don't want to be doing futile add-on treatments that cost time and money. I'm sure you can find someone somewhere who will do it. So protect yourself by listening to specialists who treat 40-year-olds and have a vested interest in keeping up to date with the latest research. A good specialist will be less likely to recommend dubious add-on treatments because the risk to their reputation is far greater. I will interview specialists who treat older women to find out from them what treatment tends to work for this age group and the pros and cons of add-on treatments for this age group. You don't want to sacrifice your time and money or well-being on questionable treatments.
Thank you for watching Making Babies in Your 40s. Would love to know what you think and what you would like covered. Please leave your comments and subscribe to my channel. See you next time.